So today we are going to talk about another disease of the Pranavasrotas, which is CAS. Now, CAS is a very commonly seen disease, just like we saw yesterday Pratishyay, which is common cold. CAS is also a very common disease, but also a difficult disease to treat. And meaning the Ayurvedic practitioners in India, they think that one of the difficult diseases to treat um, is CAS. Now, in literal meaning or in English, if you have to look at what CAS means, it means the coughing. Okay, so Ayurveda has considered cough, which is a symptom in the Western science of other conditions, as one of the diseases itself. Which is interesting because the Western science considers cough as or coughing as one of the symptom or one of the sign of many other respiratory system diseases, whereas Ayurveda has considered this as an individual disease on itself. And you can see that this disease is very commonly seen and can be pretty disruptive in terms of disruptive to a lot of people. um, I remember talking to uh, one of my friends, and he was meaning how a simple thing like cough can be disruptive in life. Is I had a friend who used to have dry cough. Okay, and dry cough meaning he could not sit idle without having to cough or without having to clear his throat even for 5 or 10 minutes in continuously. And as the night would approach, the situation would worsen. As the night would approach, the situation would worsen, and he would have to continuously take maybe warm water or maybe some infusions or some teas, and he would keep on drinking them, because if there were days, or there were nights rather, where he would constantly have the dry cough, where there was no expectoration, no mucus coming out, but as if there was something stuck in the throat. He couldn't breathe properly, he couldn't lie down. So it was pretty disruptive. And basically, once I remember he telling me that, I don't understand how you people can live 24 hours without having a single bout of cough. I can't imagine my life like that. So it was that serious. Luckily, he was diagnosed properly, and later the problem resolved, which is great. But this is something which seems like a very small problem, but it can be pretty disturbing to a lot of people. And we have seen this during COVID also, where during COVID, coughing was one of the major symptoms, and people would cough their heart out literally, with tremendous amount of pain and discomfort. So, and even Ayurvedic doctors, like I said, consider that this is one of the conditions which is very difficult to treat, because um, one, it is difficult to diagnose as in terms of what is causing it, and then treatment also is, you have to be very careful in how you treat it, etc. So though it seems like a very small issue, but it's a very common problem which people face, whether you're dealing with it as a part of another disease symptom sign, or whether you're treating it as under the Ayurvedic concept as a disease on its own. So today we're going to talk about that, and then we will continue doing some other studies like the herbs, etc. So when we talk about Cas comes from original. Yes, yes, Petro.
Manish, can I ask you a question not related to this?
Yes, please.
I have my honey with the turmeric, and I wanna check this with you. Like like a lot of fermentation start appearing on the top. Uh, I don't know if you can see it, like foam,
Is it is it
and
is it fermenting? It is
yeah,
fermenting.
yeah.
Okay. I don't know. Maybe something may be going wrong, because I like I have a bottle in my fridge. I can show you right now. Which
Yeah,
is has been there for 2 months, which is not like this. So maybe something is gone wrong in the process, maybe because
you
it
keep
should
it
not
in the
ferment. It should not
y-
ferment.
and you keep it on the fridge.
Yes, I keep it in the fridge because in India
Perfect.
the temperature is very high. Like
I think
India,
well, yeah, I
yeah,
will do
like
that because I have it in the pantry.
yeah, so we put it in the fridge because here, like this is winter now, but still, the average temperature is, the lower temperature is 6 or 7, but the average temperature is still, day temperature is 26, 28. So it's still, pretty warm during the day. So we keep it in the fridge, but in the fridge, it's been there for 4 months now.
Perfect.
Absolutely fine. Yeah, yeah,
Yeah, yeah, I will do that.
yeah, yeah.
Thank you.
Yeah. Also, when we wash the turmeric, I mean, one thing which I have observed is initially the turmeric taste is very strong, the bitter taste. Okay, but as the honey gets absorbed, it starts becoming more sweet in taste. That's also something that I have observed. So probably it would be better if we make smaller batches rather than making a big batch and using it for 4 5 months. I'm not seeing any difference in qualities, but just it becomes more, I would say, more palatable after a couple of months. Maybe it reduces its strength. It lets go of its bitter taste, maybe in the honey or something. Yeah. So yeah. So when we talk, coming back to kas, so kas comes from original word called kas, which is the origin for kasa, which indicates motion or movement. So in this condition, vata moves out at a speed through the mouth, making a peculiar sound. Hence, it is called as kas. So basically, the vat moves out of the mouth. It is expelled out of the mouth at a speed. So forceful expulsion of vata through its mouth, resulting into a peculiar sound. Hence, it is called by the word kas. Um, so cars also, I mean, just to give you an idea, you will not be able to relate it, but there is a particular type of a vessel which is used in India, which is which makes a typical kind of a sound when you bang it. So that cast word comes from that vessel and the sound that the vessel makes, which is also unrelated to you, but that's how it's been uh, named. Now, when we look at the types of kas, that is coughs, it's Vataja, Pittaja, Kaphaja, Shataja. Shata means trauma, Kshayaja, Kshaya means depletion, and so these are the five types, and each one is stronger than the earlier one. So the Pittaja is stronger than the Vataja, the Kaphaja is stronger than Pittaja, Kshataja is stronger than the earlier ones, and Kshayaja is stronger than the earlier ones. So Vataja, Pittaja, Kaphaja, Kshataja, which is trauma, so trauma caused to the lungs, and Kshayaja, depletion of tissues, basically. When we look at the causative factors, the causative factors are dust, smoke, they cause the blockage or obstruction in the respiratory passages. So just like we saw yesterday also, that there are certain causative factors which are responsible for the sthana vaigunya or vikruti of the organ, vikruti of the system. So there are certain causative factors here which will be dust, smoke, which will cause blockage or obstruction in the respiratory passages. There will be Then there are other symptoms, other causative factors, sorry, like excess exercise, eating dry foods, anna vimarga gamana, which means the food gets into the respiratory passage by mistake. So when you are consuming food, instead of going into the esophagus, it goes into the trachea, forcing the urges. So forcefully coughing or forcefully sneezing, forcefully, so creating the urges forcefully or suppressing the natural urges, that is also one of the causes. Then foods which are irritating or inflammatory kind of foods, like alcohol, smoking, those kind of foods which cause inflammation in the body. Heavy foods, foods which are obstructing. dry foods or abhishandi foods consumed regularly. So when somebody consumes this food regularly, that also is the cause of um, the disease. Cold beverages and cold foods, cold places. So exposure to cold, maybe like your room is very cold, you constantly sit in air conditioned environments, you constantly drink cold beverages, eat cold foods, so that also is one of the causes. Now today if we look at it, I think exposure to cold is one of the major causes which people have in their lifestyles, because people are constantly sitting in the air cons or air conditioned environments when they are working, particularly in countries like India, etc., where people are working in uh, IT sector, software sector, etc. Um, the the offices are so cold, they are constantly running at a temperature of 14 degrees, 12 degrees, 14 degrees, 16 degrees, and then people have to wear sweaters and jumpers in summers also. But then what happens is the moment they come out of the office, the temperature outside is 30, 32, 35 degrees. So the constant change in the temperature also is very, very dangerous to the body, because the body cannot constantly keep on adjusting to the changes in temperature. And this can be one of the reasons for many diseases, not just the respiratory system diseases, but also diseases related to liver, because the hot and cold opposite constant change causes disturbances with the liver. It can be disturbing to the rakta dhatu, because rakta dhatu gets disturbed by this constant change of hot and cold temperatures, and that can result into various skin diseases also. So people who are getting exposed to these kind of environments, you will find that these people are basically vata aggravated, they will be having raktadushti also in them. Their agnis will also be disturbed, and you will find conditions like maybe respiratory problems like cough, sneezing, recurrent cold, sinusitis, or you may find conditions like skin diseases in them very commonly. So, but obviously these are lifestyle situations where you can't do anything. You can't ask them to not sit in those aircon environment. Yes, Dhoni, you had a question? No? Okay. Cold beverages and cold foods or cold places, that's very important. Then excess walking, running, exertion, langan, that is fasting, any physical trauma, day sleep, and excess sex. So primarily what that means is any physical activity which is beyond one's capacity, that will also cause the problem in these cases, or that will also be one of the causative factors here. So any physical activity, whether it's you go to the gym and overdo your exercise, or people who work or in their work situation they do physical activities, if they overdo that, they do beyond their capacity, that also will cause the problem, or that will also be the causative factor. So excess walking, excess running, physical exertion, physical trauma to the lungs or to the chest region, day sleeping, excess sleep, excess sex also is a physical activity which causes vata aggravation. People who have vata aggravation, who indulge in excessive sexual activity, or people when they get of a certain age and when they indulge in excessive sexual activity, you will find these people complaining. If they are vata aggravated, they will have low back ache, low back pain, etc. Low back pain after the sexual activity is a crystal clear indication that the vata is getting aggravated because of that. So they need to counter that vata aggravation by maybe abhyanga, maybe snehana, etc., which they might not be doing. So this is, you will see symptoms like this. People don't understand why, after having, sexual activity, my back is hurting. So it's nothing to do with, the way you did it or the position, etc. It's simply the vata aggravation that is causing it, and that needs to be addressed as well, because after a certain age a lot of people face these problems. So this is simple vata aggravation because of physical exertion beyond one's capacity. That is the reason for that. Langhan also, so fasting. So fasting beyond one's capacity, that is also going to cause vata aggravation. Incompatible foods, overeating, not eating. So those also are the causative factors. And then obviously ama formation and obstruction to channels due to kapha or due to ama. So when we look at the causative factors, you will find that the causative factors are combination of vata aggravating factors mainly, and also some factors which are going to cause kapha increase. Like abhishandi foods, cold substances, armor formation. So those kind of uh, causative factors are also there in this. But mainly you will find that people are having problems because of maybe physical activity being done excessively, or people are having problems because of dust, smoke, and various kinds of allergens which they are exposed to. Now, the causes have been also explained based on the various types. So, when we look at Vataja type of cas, the causative factors given are Ruksha, that is dry foods, Shita, cold foods, Kashaya foods, that is astringent foods, less amount of food or langhan, excess walking or physical exertion, excess sexual activity, suppression of natural urges, late nights or no sleep or less sleep. So basically, you will have all the vata aggravating factors like dry foods, um, astringent foods. So you can even look at, not just astringent, but also the bitter pungent foods will also be, involved in this. That will also cause vata aggravation along with pitta, but kashaya will predominantly be vata aggravating. Cold foods, less food or langan. So people have a tendency of eating less. So that will also cause vata aggravation. Excess walking or physical exertion, sexual activity, suppression, and late nights, like sleeping very late or not sleeping enough, less sleep. So those will also be vata aggravating factors which will lead to uh, the Vataja type of cast. Then in Pittaja, you will find that pungent foods, Ushna foods, heating foods, Amla rasa, that is sour taste, burning or inflammatory foods, eating excess of salts, anger, excess exposure to heat and sun. So the causative factors again are very clear, very crystal clear. Pitta aggravating causative factors have been given, which cause the Pittaja type of cast. So pungent heating, yes, Doreen.
What does it mean, Ksha? Ksha,
Salt, salts.
salt.
Yesterday we had said that, you asked me what do you mean by ashes, right? What is the ash of the herb? So I said they are called as kshara, but here I have mentioned it's as a ash, but it's a kshar, which is mainly herbal one where certain herbs have salt content in it, which they are burnt, or which when they are burnt they give those salty uh, kind of extract, which is used in treatments or which is used for consumption purposes, which can be pitta aggravating. Okay. So then kafaja, heavy abhishandi foods, sweet taste foods, snigdha foods, anxious foods, day sleep, and sedentary lifestyle. So again, very clear kapha aggravating factors are there, heavy foods, etc. Shataja kas, which is the kas which is cough caused by trauma, which is mainly caused because of excess exercise or exertion, excess walking, activities beyond one's capacity, shouting loudly. So basically, talking excessively or shouting loudly, excess exercise, exertion. So this can actually cause a physical trauma to the blood vessels or to the lungs, and then that will lead to Kshataja type of cast. Now, please understand that, when we talk about excess exercise or exertion, activities beyond one's capacity, we are not simply talking of, an activity of lifting something or say for example, you lift say 100 kg and one day you lift 120 kg, that's going to cause it. So people who do physical activities, people like for example people who do really strong, very heavy physical activities, they are constantly doing excessive activity compared to their body strength. And if as a routine lifestyle, the activities that you're doing are not compensated by enough nutrition, by enough vata pacifying activities, then that will lead to vata aggravation constantly happening. And then eventually, it will result into some damage, some tissue damage, some damage to the walls of the respiratory system, which is called as kshata or trauma that happens there. And then that will result into this type of kasa originating, which is originating from the trauma to the respiratory channels or the respiratory system or the respiratory passages mainly. And then Kshayaja type of kasa that originates from incompatible foods, amla foods, sour foods, inflammatory foods, suppression of natural urges, and grief. So the Kshayaja type of kasa is a very different type of situation where Kshaya, that is depletion of tissues, happens. Now depletion of tissues is the reason behind Kshayaja kasa, and depletion of tissues will happen primarily it will originate from one simple thing, which is your agni is disturbed. So your agni is disturbed and the tissues are not being nourished properly. That will be the main cause of kshayajakas. And it will also happen in cases of people who are suffering from some chronic disease or some serious disease for a very long time, where they are not recuperating, they are not gaining the strength back, their body is not getting nourished. Like for example situations like cancers, AIDS, where the body is constantly depleting, body is constantly losing its muscle, losing its tissues, etc. So those situations will result into kshayajakas, which is mainly a situation where the body undergoes severe kind of emaciation or loss of tissue, and then this type of cas originates from there. So the the cas is happening as a resultant of the loss of tissues and loss of body tissues or the dhatus. Now, when we look at the causes, we can clearly distribute them into three types. Causes which are cause sthana vaigunya, that is the sthana vikruti, like the smoke, dust, talking loudly, amla and inflammatory foods. Vata prakop karana, reasons, which is ruksha, obstructing foods, excessive exercise, sex. And then srotarod or vata pratiloma, that is the causative factors which causes change in the direction of vata because of obstruction, that is suppression of natural urges and ama. So you can clearly divide the causative factors into these three types, which is sthana vaigunya, vata prakopa, and srotorodha, which is obstruction of the channels, and also which lead to the vata direction changing and moving in opposite direction. Now the samprapti is very, very interesting here. So two things happen simultaneously. The causative factors which will increase the vata, they increase the vata, they cause vata prakopa, and certain factors will cause srotorodha, which will cause the obstruction. Now, when these two things happen simultaneously, apana, which is normally it is functioning downwards, the normal functioning of apana is downwards. Because of the srotorodha, because of the obstruction, it starts functioning upwards. Okay, so the apana starts functioning upwards. When that happens, the udana that is naturally moving upwards, because of the apana starting to move upward, it starts pushing the udana upwards in a faster way. So the speed of udana is further increased. Now this udana speed that is increased, that causes, because it's moving upwards, it is trying to force its way upwards, at a speed which is higher than the normal speed, it starts causing obstruction to the prana which is moving downwards in its normal situation. So the prana which is moving downwards, the udana which is moving upwards, they are normally functioning very smoothly because they are in the same passage moving upwards and downwards. Now the apana from down, from the pelvic region, from the intestines, because its direction gets changed and it starts creating a pressure upwards, it starts pushing the udana upwards. So the udana starts moving upwards forcibly, causing the movement of prana to also get disturbed. Now, when this happens, this opposite movement where Udana is moving forcefully, Prana is trying to move downwards, it causes friction between these two vayus in the respiratory passages. Now, this respiratory passage also basically has a lot of mucus in it, right? Because we have seen there is avalambak kapha, chest is already a main region of the flame or kapha. Now, what happens because of this, the vata aggravation is this kapha, which is there doing the function of lubrication and also allowing, because of the lubrication, also allowing smooth movement of prana and udana to happen. That kapha, it dries up because of excess vata there. And when it dries up, this kapha, which is naturally free flowing, it becomes sthana, it becomes sticky, and it sticks to the walls of the respiratory passages. Instead of flowing, it sticks to the walls. So now you see there are multiple things here. One, apana is pratiloma, it is pushing upwards. Udana, which is supposed to move upwards at a normal speed, it is moving upwards in a faster way. Prana, which is moving downwards, it is being opposed by Udana, which is moving upwards. So there is friction happening between these two. Kapha, which is a natural dosha in this system, in this area, it has become dry and it is sticking to the walls and causing obstruction further. Now, all these things, then what they do, they will also cause the prana to become pratiloma and the prana also starts moving upwards. And now the prana and the udana all together they move outwards in a forceful manner, forcibly, resulting into what we call as kas or cough. So the pathology or the samprapti is very clear. You will see this all the time that somebody who has a problem with the digestive system, the apana becomes vikrut, it causes pressure upwards, everything changes. Somebody who so here you will see that the apana starts this activity. Apana will cause the pratilom movement. Udana will start moving upwards forcibly. Prana will get obstructed. Plus the kapha will dry up, causing stickiness, obstruction. And then the prana and udana, they will all both start moving upwards in an abnormal direction of prana and the normal direction of udana, but a higher speed than it is supposed to move. And both of these will start moving outwards now, forcing the air, forcing the vata out of the mouth, resulting into what we call as cough or kas. Is that clear? So it's a very simple pathology to understand why this happens, and the subtypes are also very clearly explained as to what happens exactly. So now in this case, we clearly know that it's a udana vyana prana disturbance here. Now going forward, when we look at the purva rupa, the purva rupa or the premonitory signs are irritation of the throat, feeling as if something is stuck in the throat, itching in the throat, obstruction while swallowing, hoarseness of voice, change in voice, coating on the tongue and palate, development of small growths in the throat sometimes, and agnimandya. So when we basically look at the premonitory signs are basically related to the functioning of functioning of udana and prana. Like hoarseness of voice, which is basically a function of udana, change in voice. So, quote, then itching in the throat because what the kapha is starting to get dry. So, it will start causing itching in the throat, feeling as if something is stuck in the throat. That is also because the kapha gets dry and it sticks in the throat and it's not getting expelled, it's not getting expectorated. So, irritation of the throat. So, that's because there is this friction of vata and both the vatas happening in the throat region. So the purva rupas very clearly are telling you that something is going wrong in the throat or in the respiratory system region. So and people also realize that whenever the initial signs and symptoms of cas or cough to happen is your voice changes. You feel as if something is stuck in the throat. You're constantly trying to clear your throat. So those are the purva rupas which are indicating that you're going to develop some respiratory problem which will be mainly which will be consisting of a symptom cough in it. In ayurveda, cough itself is a disease that has been explained. So these are the premonitory signs that you will observe as of cough, of cas. And in the signs and symptoms, then the actual signs and symptoms will be seen, which will be recurrent bouts of coughing, pain in the chest region, throat region, and the sides of the chest region or sides of the body, the flanks, pain in the throat, difficulty in speaking, and lack of energy. So these will be the general signs and symptoms which will be seen. Recurrent bouts of coughing, pain in the chest, throat, and flanks, pain in the throat, difficulty in speaking, lack of energy. So these are the typical signs and symptoms. We will now go and study the signs and symptoms of individual types as explained in Ayurveda. Now, special symptoms which are Vataja. Now, Vatajakas will be indicated by pain in heart, chest, stomach, and flanks. So, there will be pain in the chest region, stomach, chest, and flanks. The face becomes pale. The face becomes very pale, whitish in color. The bala, that is the strength, voice, and the oja, they become weak. So, oja weakness will happen at a later stage. But the strength and the voice, they will become weak immediately as the problem starts. Person feels depressed. Constant coughing bouts are there. Dry cough. This is a dry cough. There is no expectoration in this. There is no mucus coming out. Forceful bouts. The person is trying to force the cough. So they are forceful bouts. The person will get relief, a little bit of relief when the person takes snigdha, that is anchas, amla lavana, which is sour and salty, and ushna substances. So, say for example, if the person takes snigdha substances like water and ghee, that will give relief to a certain extent. If the person takes water and honey, that will give relief to in a certain extent. So, consuming substances, ushna substances like chewing on to clove, chewing on to cinnamon, that will give relief basically, but that is temporary relief. Okay, then the digestive, when the food is undergoing digestion and it is in the first stage of digestion, which is the kapha stage, the bouts are less. There are less bouts. And in the post digestion, once the digestion is complete, there are more bouts that are seen. So there is a very typical indication or typical signs and symptoms you will see. What are the main things you will observe? The main things are constant coughing bouts, dry cough, forceful bouts where the person is trying to force the mucus out because it's sticking, very sticky, nothing is coming out, and the person feels as if there is an obstruction in the throat, in the respiratory channels, and is trying to forcefully remove it. Now, what happens is because the person is forcefully trying to cough, which also is an exertion, which also is an activity which is exertive activity, which also is an activity which the person is forcefully trying to do sometimes, that will further aggravate vata. and that will further aggravate vata and further cause more dryness of kapha and more problems to the person. So the situation with vataja kapha is weird because it's a dry cough. Forceful bouts are there. The person wants the mucus to be removed because that will give him the relief, but nothing is coming out. So he or she will try to forcefully expel it out, which will further cause vata aggravation, and the problem will increase. Also, sometimes what happens is the person will try to sip on to warm liquids, warm infusions, warm teas, etc., which also, because it's giving relief, the person will drink it, and it will also cause problems because if you drink too much, that also will cause heaviness in the stomach, will further cause more problems because that will also cause problems with apana, further causing more issues later on. So the dry cough is actually a more difficult condition to treat because of the dryness in it and because of the um, chances of aggravating vata whilst trying to cough expectorate things out. But here we have to understand that it is the main reason for that is the kapha that is there, the kapha in the system has become dry. And once we understand that, then the issue is much more easier to resolve. Nothing is going to come out if you try to forcefully cough, if you try to forcefully remove it. So you will have to basically pacify the vata is what is important here. We will see the in the treatment that so that is vataja kasa. Now, when we look at Pittaja Kasa, obviously it's a Pittaja situation. So, reflux is one of the important signs and symptoms that you are seeing. Burning in the chest, throat, and eyes. So, burning sensation in the chest, throat, and eyes. Dryness in the mouth. Excessive thirst, bitter taste in the mouth, blackouts during coughing. So when the person, is coughing, it is so forceful, it is so exertive that the person will feel blackouts happening. Expectoration with pitta. So the mucus that will come out, that will be with the pitta. So it will be, bitter. It might be yellowish in color. So it will be stained with pitta, or it will be mixed with pitta in it, or the person will vomit yellowish, bitter, or blood stained vomit. So again, it's a pitta that is being expelled out. So either the person will vomit because he or she is trying to cough so much that the person may vomit also. Yellowish discoloration of the nakha, that is the nails, netra, and tvaka, eyes and skin. Hallucinations, fainting, and dizziness. Hallucinations will not be seen that often, but fainting and dizziness will be seen because of the pitta aggravation and also because of the fatigue and tiredness the person will feel, and headaches. So, in this case, now when we look at the pittaja type, the the symptoms seen are mainly the reflux will be observed in these people, burning sensation will be observed, headaches will be seen, and the mucus that is being expectorated, that will be mainly yellowish in color and will have a bitter or sour taste to it. And obviously, blackouts will also be observed when whilst coughing. So this is Pittaja Kas. Yes, Doreen?
Come back on the pita. I wrote yellowish of the skin. And what is the naka and netra?
Nakha is the nails, Netra is the eyes. So all the body, the entire body becomes yellowish discolored. But again, this is they have given it as a symptom, but it has to happen. The condition has to be very chronic for that to be seen. It won't be seen like you are experiencing a pittaja type of kasa and it's been 4 days and you start observing yellowish discoloration. That won't happen. It will only happen if it is a chronic situation, long term situation, and yellowish. That then only you will see this. Kaphaja kasa, heaviness in the body. So the body will be heavy. The person will feel heaviness. Agni-mandya, aruchi, loss of taste, vomiting, nausea, reflux, excess salivation, stickiness in the mouth. So that there is stickiness in the mouth. There is a pasty, sweet coating in the mouth. Pratishaya, blocking of the nose, post-nasal secretions. So constantly the person will feel as if something is, secreting behind in the post-nasal area, which is sticky, which is getting stuck in the throat. Then there will be associated lethargy, tiredness, and itching all over the body. So in this case, the Kaphaja type, the symptoms will mainly be heaviness in the body, nausea, excess salivation, stickiness in the mouth, and obviously pratishay, like the cold and blocking of the nose, or and post nasal secretion will be an important symptom where the person is constantly secreting certain mucus at the back of the respiratory system behind the nose, which is constantly causing obstruction, or the person feels as if that's causing irritation and needs to be removed. So that these are the signs and symptoms of the kaphaja kasa. Now, when we look at the Kshataja type of Kasa, Kshataja Kasa happens when there is injury or trauma to the lungs. So, obviously, there is trauma and injury. So, this condition will start with dry cough initially, and later this will change to coughing with blood. So the person will then cough and will expectorate blood, or the mucus will be stained with blood, or there will actually be blood in the mucus, which will be either yellowish reddish in color, blackish in color, foul smelling, or there will also be clots of blood in the mucus. So you will see different types of signs, but the main thing will be there will be blood in the mucus that is being expectorated along with the coughing. Initially, it will be a dry cough, then resulting into and then moving into blood being expectorated out. Severe pain in the throat, severe pain in the chest. So pain is going to be a major symptom in this situation. Tenderness in the chest and flanks, because there is physical trauma in the chest region to the lungs, or to the trachea. This entire chest will be very tender. The sides of the chest will also be very tender. You won't touch it. You won't allow anyone to touch it. There will be severe tenderness to it. So obviously, what it indicates is severe pain in the chest region is what is indicated here. Then obviously, because there is physical trauma, inflammation is going to happen, which will then result into fever as one of the symptoms. Thirst will be observed, so person will feel thirsty. Loss of strength, loss of energy, and body ache. Obviously, when the person is losing blood, that is going to result into loss of strength and loss of energy, and then body ache. So this is a very typical Kshataja Kas, uh, which basically will start with dry cough and then result into blood being thrown out. That will be the most important sign and symptom. If there is blood in the mucus, you have to understand, or you have to examine whether there is any trauma to the lungs or the respiratory system, and pain in the chest will also be observed. So, and then Kshayaja Kasa, that is basically Agni Mandya is the main cause. So Agni Mandya resulting into three doshas aggravating. Dhatu Kshaya is resulting into Kshayaja Kasa. So the basic idea here is that because of Agni Mandya, ama is formed. There is no, the tissue nourishment is affected. Because the tissue nourishment is affected, the tissues are not being formed properly, and then that will result into Kshayaja Kasa. Like I have mentioned earlier also, this Kshayaja Kas will also happen as a complication of some other chronic condition that the person is going through, or the chronic condition the person is suffering through. So in that chronic condition also, when a person is having a chronic health problem, Agni is obviously going to be weakened, Agni is going to be Manda, and then that is going to result into the dhatu formation being affected, dhatu not being formed properly, resulting into dhatu depletion or tissue depletion, resulting into kshayaja kas, which is mainly uh, because of depletion of dhatus. Now, this kshayaja kas is also observed in old people. When people get old, when the dhatus are naturally getting depleted, the people will cough, which will be a type of Kshayaja Kasa only, and the treatment will also be like Kshayaja Kasa only, because the causative factor or the root cause or the main foundation why this is happening is mainly Dhatu Kshaya, which is a natural phenomena in old people. When they get old, when they get emaciated, when they lose their tissues, then because of the weakness, they will have coughing, which is also seen in old people. So the treatment will also be accordingly done. Now, the expectoration in this case or in this situation or in this type is greenish, reddish, or stained with blood, sometimes with pus or foul smelling like pus. So it is either dry or it is with mucus, which is green or red or stained with blood, and it is also sometimes with pus or foul smelling like pus. So Kshayajakas, Kshatrajakas, you will find that blood is there, but in Kshayajakas, you will also see that the Dhatu Kshay happened and then the kas started, whereas in Kshatrajakas, you will find the Dhatu Kshay happened later on. As the disease progresses, then the dhatu kshay happens. The person becomes weak as the kshatraja caste continues for a longer time. So the starting is different in both these cases. Severe pain in the chest while coughing, loss of weight, very thin, emaciation. These will be another other signs and symptoms seen. In general, weakness. The person will feel irritable, will also have certain psychological problems like feeling jealousy about people, feeling disgust about anything and everything. So these are very interesting mental faculties which are disturbed in Kshayajakas. Okay, it is also explained in some other diseases where Dhatu Kshay happens. Now, irritability, depression, jealousy, anger, feeling disgusted. People think like the normal food that you eat, like for example, you are eating food, this person is also eating the same food, but the person who is suffering from this condition will find that this food is not tasting good, it is smelling bad. So the mental faculties are disturbed a lot in these cases, and these people will also behave in accordance to that, which is a very strange sign or symptom explained. But you see this happening all the time with these kind of people. And the main reason for that is the ojak shaya that is happening in these people, because Oja is responsible for the strength of the mind. Oja is responsible for the Dhatu strength. And when there is depletion of tissues happening to that level, where the person is severely depleted, emaciated, the Oja also is depleted. And that seriously impacts the mental faculties. And this person will then uh, show various kinds of psychological disturbances, which or emotional disturbances, like feeling angry for nothing, feeling jealousy about other people, feeling disgust for anything, you know those kind of things. Constantly these people will constantly go and check themselves in the mirror whether they have lost weight or not. So those kind of things will be observed in these people, and the Ayurvedic textbooks have categorically explained that if somebody is doing such things constantly with a weight loss happening constantly, then that is an indicator that the Oja has been disturbed, the Oja has been weakened, the Oja has been depleted, and the treatment has to be done in accordance to that. And so these are the signs and symptoms for Shayaja Kasa. And along with that, obviously, edema, overall body swelling, the body will be swollen, there will be edema on the body, that will also be seen. Yes, Dori.
Do we consider that it's infected in this situation?
It can be infected also, because if there is, like I said, this condition, though it is Kshayaja Kasa, it can be associated with some other problems also. Like a lot of times people suffer from tuberculosis, and from tuberculosis, they end up having Kshayaja Kasa. Sometimes people are suffering from cancer. From cancer, they end up having Kshayaja Kasa. Some people are suffering from AIDS. From AIDS, they end up having Kshayaja Kasa. So there will be these diseases which are chronic diseases which will then result into these kind of symptoms. So it will be dependent whether they have infection or not. But obviously the major thing is coughing, dry cough or cough associated with some kind of, the symptoms, signs as explained above, and body weakness, loss of weight, emaciation. These will be clearly seen in these people. Okay. Now the Upadrava, that is complications. When we look at the complications are bronchial asthma, Shwasa. Shwas is the Sanskrit name for asthma, okay, which is the condition seen in a lot of people. Vomiting, hoarseness of voice, infected pratishaya, so infection with cold. So, you know, so that is there. Hikka, hikka means sneezing. Oh, sorry, hikka is hiccup. Sorry. Hikka means hiccups. Now, hiccups also has been given as a disease in Ayurveda. Okay, it has been explained as a disease of the respiratory system, which we will study later. So, hikka is another condition, heart conditions, and because in these cases the apana is also affected, you will also see complications like arsha, that is hemorrhoids, rectal prolapse, and cervical prolapse. I have seen I have seen so many people that they cough so much that they, like women for example, whilst coughing their cervix prolapses, so it is the abdominal pressure that increases, which then causes this problem to happen. So the coughing is so high, that is so intense, it is so consistent, that the constant increase in the intra-abdominal pressure can cause these organs to prolapse. What is rectal prolapse? The rectum actually comes out of the body, it prolapses. Cervical prolapse, the cervix actually prolapses out of the body, so it naturally just falls out of the body while coughing. So this is a serious problem, because one, they lose the tone of the that part of the body, they lose the control of that part of the body, and secondly, because it is prolapsing, the chances of infections of these are very high, because they are not being retained inside the body. They're getting thrown out of the body every time they get removed out of the body. So the chances of these getting infected are very high. And a lot of times they have to undergo surgeries to correct it, repair it, etc. So these are the complications of CAS. Now, prognosis, when we look at the conditions, the Vataja, Pittaja, Kaphaja, they are sadhya, they are treatable. Kshayaja and Kshataja, when they are new, it is sadhya, that is, it is treatable if the patient is strong and the treatment is started in time. So, if the patient is strong and the condition is newly formed, then it is treatable. Otherwise, it is asadhya, difficult to treat, or not possible to treat. So that is the prognosis of the CAS. Now, when we look at the treatment of this, the treatment basically revolves around certain things. One is avoiding causative factors, obviously, because the causative factors are very, very important in continuing to have the problems repeatedly. The organs and systems involved have to be treated. So you need to correct the problem, you need to do the rasayan of the respiratory system in this. Important treatments like gandush, dhumapan, and avaleha play an important role in the treatment protocol. And whilst doing the treatment, it is important to understand whether it is shushka kasa, shushka is dry, dry kasa, or sa kapha kasa, that is kapha which is, sorry, it is the kasa which is along with kapha. So the vataja type of kasa is the shushka kasa, and remaining four are the sa kapha kasa, where there is some amount of mucus being thrown out. So that diagnosis is also critical because that will define what kind of treatment you are going to do. So, like in Shushka Kasa, you will have to look at the Vata that is there, and you will have to do Vata pacifying kind of treatments there. In Sakapha Kasa, that Vata is not so dominant, so your treatment will be slightly different. Now, when we look at the yes, yes, Pedro.
Yeah, I have a question here. Like, how you can make the proper distinction of when is it, I don't know, like when is the dry cough and when is like with some expectoration is dry cough or with a lot of expectoration. For example, someone that has a dry cough, but every 2, 3 hours has a small expectoration, yellowish. Is that which type of casa, of rasa? Yeah.
So basically, what happens is, even though we are looking at vataja, pittaja, kaphaja type of cas, okay, the dryness in the cas, the dryness of the coughing is a clear indicator that there is vata involvement in that. Okay. And when you say that there is also sometimes a little bit of yellowish mucus thrown out after 3-4 hours, that is an indication that there is some mucus being thrown out with the pitta involvement in that. So even though we have said that there is vataja, pittaja, kaphaja, and then kshayaja and chataja kasa, there will be combination of doshas which will also happen in the uh, etiology or in the samprapti. So you will have to look at it in a way where the condition that you're talking about, we will have to look at it whether it is a vata pittaja kind of kasa, where it's a dry, then after some time it is little bit of mucus is thrown out, resulting, and it is yellowish in color, so it is obviously indicator of pitta, and little bit of mucus, so that we'll have to consider whether this is a vata pittaja kasa and treat it accordingly, because the dry cough which is there in the initial stage indicates very clearly that 3-4 hours of dry coughing followed by a little bit of mucus is an indicator that predominantly it is a vataja type of cas. And then later on, because of maybe things you have taken, etc., like you have had some infusions, etc., a little bit of mucus is being thrown out, that is also possible. But dominant dosha will be obviously here vataja type of casa only. Okay. Now, in the vataja type of casa, the treatment is mainly snehana with vata pacifying herbs. Snehana is oleation, but you have to consume these substances. So, what are those type of ghees? Kantakari ghee. Kantakari is one of the herbs that we are going to study. Kantakari ghee, rasna ghee, and sorry, and pippaladi ghee. So there are three types of gruta that have been explained. So you can basically make a gruta from kantakari. We'll study that herb, rasna, or pippali. So ghees with vata pacifying herbs is what is suggested as the first line of treatment. Basti with sneha also is used. So enemas can also be given with oil, which is anuvasan basti. So small quantity like 30 mils or 60 mils of oil enemas can be given for the same purpose. Vatagna oil massages. So oil massage with vata pacifying herbs, which is like say shatavari, ashwagandha, bala, those kind of substances or those kind of herbs can be made into oils, and vatagna oil massages can be given. Parishek and avagaha are also useful. So parishek is dhara and avagaha is bath. So hot parishek, hot water, hot dharas or hot warm baths, they will also be useful. So what is this indicating? This is indicating that in a Vataja type of kasa, it is important that you pacify the Vata which is there. What will that do? When you pacify the Vata, the first and foremost thing that will happen is when we look at how the Samprapti will be broken, when you pacify the Vata, that Vata which is drying up the mucus in the respiratory system and causing obstruction, that dryness of mucus will be reduced. The mucus that is there, the kapha that is there, which has become dry, because of which it has become sticky and it is sticking to the walls, that pathology would be broken when you use these vata pacifying treatments like consuming ghee, basti, enemas, abhyanga, parishek, avagaha. All these will break that pathology. Once that pathology is broken, and once the kapha that is there in the respiratory system, it starts flowing smoothly, the obstruction is removed. That obstruction, when it is removed, it will create a smooth movement of prana and udana, which was otherwise getting obstructed. Why does prana become pratilom? It becomes pratilom because of two things. One is the udana that is forcing it upwards, and second is the kapha that is causing obstruction in the channels. Because of two things, the prana becomes pratilom and it starts moving upwards. So first you remove the vata dosha that is causing obstruction, dryness of the kapha. So you remove that pathology part. The kapha will start moving smoothly. It will start doing its function of lubrication. The function of kapha that has changed from lubricating to obstructing, it will change back to lubricating. The moment it starts lubricating, what will that do? The functioning of prana and udana will become much better. The moment the functioning of prana and udana becomes much better, the friction between the prana and udana will reduce. Once that reduces, the symptoms will also reduce. And then in addition to that, you do the other treatments, which is like giving avaleha. So what kind of avalehas can be given? You give them kantakari avaleha, you give them chitrak avaleha, you give them kantakari and haritaki avaleha. So all these are basically herbs or plants which are excellent for Vataja type of kasa, Vataja type of problems or respiratory system. So avaleha, that is marmalades made from this, can be given. Then another thing is you can make a marmalade from pomegranate rind. So the skin of pomegranate fruit is excellent for Vataja kasa. So that can be made into an avaleha, or you can simply make a decoction of it and consume it. So pomegranate is a very interesting fruit, I would say. Like for example, it's a compound fruit. So the rind is there, then inside there are small individual fruits because each of them has a seed inside it, right? So it has the single fruit, which is the red pulp, and the seed inside it. So when we look at all this together, the pomegranate skin, the pomegranate rind, has a very different effect that will be used for conditions like vataja kasa. Okay. Then the pulp which is there, which is the fruit pulp, that is pitta pacifying. Okay, it is sweet, it is amla, it is pitta pacifying. It is excellent for constipation, etc., reducing constipation, etc. It is pitta pacifying. It is rakta vruddhikara. It increases the rakta dhatu. It increases the rasa dhatu. Okay, and then the seed inside it is excellent for diarrhea and dysentery. It stops the bowel movements. It is grahi in its action. It binds the stools. So one single fruit, if you know the various components, you can use it effectively. Please understand that a lot of times people say that, make the juice of pomegranate. But it is important to understand whether the juice has to be made with the seeds crushed in it or the seeds are not to be crushed in it. Because if you crush the seeds, you are adding the astringent property into the juice, which can be then constipating, which can be binding, which may not be required for even conditions like CAS, like the pomegranate juice which is there, which can be like a good thing for people who suffer from pitta jakas because of the pitta pacifying properties. But the moment the seed is crushed, it becomes kashaya, it becomes astringent, and then it will not be helpful because it will increase the dryness in the respiratory channels. So understanding these small minute changes are important, but here pomegranate rind, the pomegranate skin, is very useful for Vataja type of kasa. An avaleha made from it or a decoction made from it can be consumed for Vataja kasa. Then two types of churnas have been explained. Talisadi churna, which is there, and Lavangadi churna. Both of them can be used for treatment purposes. There is another one called Sitopaladi churna, which also can be used for these purposes, which is available in the center also. Yashti Madhu churna, which is licorice powder. Licorice powder can also be used for Vata Jakasa. Then there are three herbs combination: Draksha, that is black raisins, Kantakari, and Punarnava. So these are three herbs out of which the two herbs Kantakari and Punarnava we are going to study. So Draksha, Kantakari, and Punarnava, these are three herbs. So these powders of three herbs with honey are consumed. And for basically irritation of the throat, etc., you can do a haridra and salt gandush. So for people who have irritation of the throat, coughing in the night, you can do haridra and salt gandush, that is gargling with warm water, haridra and salt added in it. Gargling gives excellent results for um, the irritation of the throat and cough bouts happening. You can also use haridra with milk. So the turmeric milk that is there, that can also be used for this condition, because haridra is naturally astringent in its taste. So to pacify that effect, if you mix it with milk, it pacifies that astringent property, and then it can be used for vataja type of kasa also. Uh, and that gives excellent results as well. Then the pittaja type of kasa, again, Ghrutapana is followed by Vamana. So some Ghruta, that is ghee, has to be consumed. It can be followed by Vamana. In these cases, Vamana is to be given by licorice decoction and sugarcane juice. So Vamana is vomiting process, which is done by licorice infusion, licorice decoction, and sugarcane juice is given, and vomiting is given to expel out the excess pitta and excess kapha. If kapha is liquefied, when the kapha is liquefied, then use cooling and snigdha substances. If kapha is still thick, then use cooling and dry substances. Chandan, Draksha, honey, amalaki, and lotus avaleha are given. So all the cooling herbs, Chandan is sandalwood, Draksha is black raisins, honey, amalaki, and lotus. An avaleha made from this is given as a treatment for pitta jakasa. Excess kapha is associated, then musta and maricha can be added. So if the pittaja has a lot of mucus being thrown out, there is a lot of obstruction that is seen in the channels. You can see there is a lot of expectoration happening. Then you can add musta and maricha in the avaleha, or else the avaleha that has been given, chandan, draksha, honey, amalaki, and lotus avaleha can be made. Then in the treatment, these three products are very useful. Sitopaladi churna, which is mainly spices and sugar candy, which is the main function of Sitapaladi Churna is it it removes the bad kapha and creates good quality kapha. So it will basically create good quality kapha and it will pacify or it will destroy bad quality kapha. So that is the function of Sitapaladi Churna, and hence Sitapaladi Churna is very widely used for all kinds of cough problems, all kinds of cas. People, like for example, when women are pregnant, okay, they have very uh, a lot of women have problems of coughing. Why? Because the intra-abdominal pressure has increased because of the baby, because of the fetus. And that can cause pressure on the diaphragm, that can cause pressure on the chest, and the Udana Prana functioning can get disturbed. In those cases, Sitopaladi Churna proves to be very effective and it pacifies the cough reflux. Okay. It is important that the cough reflux has to be pacified in pregnant women because you cannot constantly keep on increasing the intra-abdominal pressure in pregnant women because there is fetus in the abdomen. So if you are constantly coughing and you're constantly increasing the intra-abdominal pressure, that can cause problems with the pregnancy. That can result, if the cough is very strong, that can result into miscarriages, etc. also. And that's why this has to be controlled, and Sitopaladi Churna plays a very important role in these conditions because one, it is very safe to use. It doesn't have anything that is going to be contraindicated for pregnant women, or rather there is anything contraindicated for anybody in that product. It can be used for kids, babies also, it can be used for older people also. It's a very, very safe product. It basically has sugar candy. Okay. It has got pippali. It has got cardamom. It has got cinnamon. Okay. And it has got one more thing which is made from it's a bamboo extract. Okay. So there is an extract which comes out of bamboo. So that is used. So if you look at it, it's a very safe product and a very effective product for dealing with respiratory problems as such, and mainly the problem of CASA, that is coughing. Yes. Sure.
Can it be given to breastfeeding woman?
Yes, absolutely. It's an absolute safe product because, like I said, it has only sugar, it has got cinnamon, it has got cardamom, and it has got pippali. Okay, and then it has got this extract of bamboo which has no adverse effects. In fact, it is extremely nourishing. It is balya, it gives strength, and it also destroys or it pacifies bad quality kapha. So nothing is there in this product which is can be said that it is problematic for anybody. Then another product that is there is Drakshasava. Drakshasava is medicated wine made from grapes. Okay, so that is uh, also given for Pitta Jakasa. And then the next product that can be given is Vasavaleha. Vasavaleha is a marmalade made from Vasa. Vasa is a herb which we spoke yesterday about. Adatoda vasaka, that's the name of the product. We are going to study this herb. Uh, this is made into an avaleha. It is also available in form of a cough syrup called Vasocin, which is present, which is there in the center also, which is excellent again for these kinds of coughs. In fact, Vasocin, which is available in the center, has got Vasa in it, it has got basil tulsi in it, it has got licorice in it, it has got Kantakari in it, which all these are excellent for respiratory problems and coughing. Along with that, there is cinnamon added in it and cinnamon oil also added in it. So the cinnamon oil has been proven as an antibacterial thing, anti-tubercular thing. Research has been done and it has been proven that the cinnamon oil is excellent as an anti-tubercular thing. So infections of the respiratory system can also be dealt with by this product. So if Vasavaleha is not available, Vasavaleha is not possible to be made available there, then Vasocin is something that is easily available and can be used as well. Then the next condition is Kaphaja Kasa. In Kaphaja Kas, if the patient is strong, then we give Vamana. And in Shamana treatment, in pacifying treatment, we use Katu Ruksha Ushna substances. The natural line of treatment can also be with Virechan, Nasya, Dhuma. Dhuma is smoking, Kavala, Gandusha are also helpful. But again, these treatments will be difficult for you to do. So if we go and look at the preparations, there is something called as Rasa Sindur, Vasa Hingul, Abhrag Bhasma, Nagaguti. All these preparations are Ushna and help in absorption of kapha. Now, Rasa Sindur is something that I want you to research on. Just like I asked you to do on Hingul, I want you to research on Rasa Sindur. This one here. Please make a note of it. Okay. And we will talk about these later on. Basically, some of these preparations I'm going to explain them when we study the formulations. Some of these formulations. Then in the herbal ones, Karpuradi Churna, Karpura means camphor. So this is a powder made from camphor. Samasharkara Churna, Chitrakadi Churna, Marichadi Churna, these can be used. Also, Bhallatak, the another herb that I asked you to research on, Bhallatak, which is a very strong, potent, very heating kind of substance that is also used in form of wine or in form of a preparation like a papadam, parpati. It is used in conditions where there is vata associated, and khadiradi vati is used in kaphajakas. Now, in Kafajakas, Khadiradi Vati is used. Today we are going to talk about Khadiradi Vati. I'm going to explain what it is so that we will talk about briefly. So in general, Kafajakas, it is said that you need to do some kind of virechan or some kind of vomiting treatment because it is excess of kapha in the body which needs to be removed. So a laxative can be an excellent way of removing excess kapha out of the body. And then treatment like Abrak Bhasma can be used, which is there. Tribhuvan Kirti, which we studied yesterday, the product that can also be used in Kafajakas because it has got ingredients which are basically kapha pacifying, kapha reducing, drying in nature, and heating in action. So Tribhuvan Kirti can be used. I'm going to talk about one more product which is called as Shwas Kutar, which can also be used in this condition. So I'll explain that also today. So Shwas Kutar can also be used in Kapha Jakas. Now the next one is Shataja Kasa. Now when we study Shataja Kasa, this is an acute condition. Loss of blood is happening and hence it can be life threatening and treatment has to be done immediately. So Madhura and Balya substances are to be used to increase the strength and the mausa. So Madhura and Balya substances basically will include substances like say Ashwagandha, Shatavari, Bala, licorice. These will be the substances that will be used which are Madhura, which is sweet, and Balya, that is giving strength. Treatment in accordance of the dosha association is to be done. So when you have Kshataja Kasa, the main symptom is basically blood along with the sputum, along with the mucus. That is the main symptom. But along with that, you will see associated dosha symptoms. Whether there is say pain in the body, whether there is pain in the chest region, whether there is dryness to the cough. So based on that, you will then choose the dosha associated treatment according to what we have studied in Vata Pittaja and Kaphaja. Ghee Abhyanga or Taila Abhyanga is done. So massage application of oil is done. Mausa Rasa. So soups of meats will be given. Meat soups like say a chicken soup or a chicken broth or a lamb broth or a beef broth, whatever meat is acceptable, meat broths are to be given because that meat broths directly will help in nourishing the body, will repair the tissue damage also, increase the strength also, without causing any additional stress on the digestive system. So it will be easier to digest and it will quickly restore the strength and energy. And that is why Mausa Rasa plays a very important role, not just in Kshatrajakas, but also in Kshayajakas, where the body strength has been depleted, the person is emaciated, has lost a lot of weight. And then Rakta Stambhana treatment has to be done. So Rakta Stambhana, that is stopping the bleeding, has to happen. Like we did in Rakta Pitta treatment, the upper orifice Rakta Pitta treatment. In a similar way, you basically can give mild laxative to stop the bleeding. You will use Vasa, that is Adatoda Vasaka, for stopping the bleeding. So those kind of treatments will have to be used to stop the bleeding. Um, Licorice, Bala, Ashwagandha, these are substances, like I explained, these are substances that can be used. Sitopaladi churnam is also useful in these conditions, basically to give strength. It is sweet in nature, it gives strength, and also it will help in uh, reducing the irritation of the entire channel as such. Yes, Dory?
For those who are vegetarian, can the meat soup be avoided? Is it not a necessity or is it a necessity?
What way? Sorry, can you repeat?
For the meat soup, for those who are vegetarian, can we avoid?
So yeah, I mean, it's a choice. It's a choice, So you, if a person is choosing not to have it, you're not going to force feed the person, obviously. But as a treatment, it's also important to understand that when you are unhealthy and you are in a situation which is life threatening, being vegan, being vegetarian, being non-vegetarian is secondary. First, you have to become healthy, you have to get back your life in order, then you can go back to your choices. So that is also something that has to be explained. But at the end of the day, if the patient denies to eat it, then that's it. Then you will have to go with the herbal preparations. You will have to keep on doing it, slowly. You will have to maybe introduce soups of vegetarian kind of stuff, which will increase the strength. Like you will have to use maybe moong, you will have to use the black gram. So, you'll have to use maybe soya, you will have to use, those kind of things which will increase strength instead of the animal protein. Then the next one is Shayaja Kasa. Now, in Shayaja Kasa, it's a chronic condition with all symptoms. There is no use of treatment. If the condition is very chronic and you see all the symptoms, the treatment is not really useful. If the condition is newly formed and the strength of the patient is good, then the treatment helps. What is to be done? Agni Mandya has to be treated first. So you have to first deepen has to be done, the Agni has to be improved, and then the Bruhana substances, Bruhana is nourishing substances, are to be given. In this, you can use Guduchi ghee, Haritaki Avaleha, Dashamuladi ghee. So these are some of the substances, but the basic principle behind this is deepen and then nourish the body. That is basically the idea. So obviously, again, here also, because you are doing deepana and nourishing the body, heavy substances given suddenly will not really go very well with the person, because the strength of the agni is less. So again, giving soups, giving broths, those would be very useful in this person also. So use of soups, broths has to be done, which are nourishing to the body, which gives strength to the body. Now, some of the products which are made with gold, gold plays a very big role in Shayaja Kasa. So, some of the products which are made with gold have been explained here. We are going to study some of them when we study the gold preparation. So, we will be studying some of them. So, products like Lakshmi Vilas, Vasanta Kusumakar, Suvarna Malini Vasanta, and Makar Dwaj, these are some of the products that can be used in these conditions. Okay. Now, my choice of usage would be Vasanta Kusumakar um, and Makar Dwaj. I would use these two more because these two will give strength to the body also, which will also help in correcting the other health problems the person has. So these would be my personal choice of using, but these are four of those which have been explained in the textbooks, which can be given for Shaya Jakas. But gold is very critical. So, use of gold. So that will give energy, that will give strength, that will improve the immunity. So that is very critical to be used. Now, Pathya. The Pathya is liquid foods, liquid foods, light foods, and foods that increase the strength have to be given. Substances like rice, wheat, black gram, moong, they are suggested to be used. Garlic, pomegranate, goat's milk, and ghee, that also has been suggested to be used. Apatya is cold foods, fried foods, abhishadi foods, smoke and dust, excessive talking, and day sleep. These are to be avoided. Now, goat's milk is something which is very important in respiratory diseases. Okay, any kind of respiratory disease, whether it's bronchial asthma, whether it is cas, whether it is pratisha, whether it is common cold, goat's milk is something which is like a treatment to a lot of people. Now, what is the idea behind that is the goats, they naturally have a immunity towards certain respiratory problems. The worst respiratory problem ever seen by the world has been tuberculosis. Okay, infection of the lungs by the tubercular bacteria, which has resulted into huge amounts of deaths across the globe. Okay, now tuberculosis has been eradicated by vaccines and treatments, etc., etc. A lot of places it still exists. Okay, in third world countries, a lot of third world countries it still exists, but goats have a natural immunity towards tuberculosis. So taking a cue from that, taking an idea from that, you will find that goat's milk has been suggested in a lot of respiratory diseases. The mention is not of this that they have an immunity towards tuberculosis, but you will find when you go back and when you study and when you learn more, you research more, then you find out that the goats have a natural immunity towards tuberculosis, and that is the reason probably goat's milk has been suggested to be used by people for the people who have respiratory problems. So even yes, I'll come back to Nikki. So even when you people who have lactose intolerance, people who cannot really digest milk, in those cases also goat's milk can be given. Goat's milk can be used as a treatment or as a immunomodulator for improving your immunity towards the respiratory problems. Okay, goat's milk is naturally more drier than cow's milk. It is more astringent than cow's milk. It is not as sweet. Okay, it is lighter also than cow's milk. So the properties are also very different. It also is a like a immunomodulator for the respiratory system. Yes, Nikki.
Yeah, okay. So you sort of answered my question. So you would say someone did have asthma, you could just use it in the Rasayana period. And so would you do it for sort of like, a few months until they seem to be getting better, or is there a certain, or just
So
Ideally,
I mean, using goat's milk is a better way of doing it rather than moving from cow's milk to goat's milk is a easier way to do it. But obviously, taste wise, it's not a great product. I mean, a lot of people may not like it, so you can do it for a certain duration, like say 90 days or 42 days, and then stop it.
Yeah. And do you have to double boil it with water like you do with cows?
That will obviously be a better way because you will make it further lighter, and you will also reduce any chances of any mucus formation that's going to happen. You can also do the pippali thing with goat's milk also.
Yeah. Okay. And so with all those different types, Vataja, Pittaja, all those ones, you should or could introduce goat's milk when they're having an attack of this.
Yes, I would say that goat's milk can be used for any respiratory problem.
Okay.
Not just the cas, but
Yep.
also for people who suffer from recurrent respiratory colds, etc. People who also have bronchial asthma. So all these people, goat's milk can be introduced.
Okay. Right. Thank you.
Okay. Yeah.
One.
Manish, hi, it's Sonia here. I've just
Yes.
got a question about goat's milk.
Yeah.
For those people for whom it is asatmia, like they find it really disgusting to drink, but they know it's beneficial for them. Can you make some suggestions? Would you like put turmeric in, or cinnamon, or sugar?
Yeah, so the concept is the same. A lot of people find cow's milk also disgusting, So what we do, we add turmeric, we add saffron, we make it palatable, we make it tastier. So the same thing we can do with goat's milk also, and then make it palatable, and then probably make them have it. Yeah,
Thank you.
clear? Is that?
Yes, thank you.
Yeah,
Thank you.
yeah. Okay. So, we can use turmeric, we can use saffron, cinnamon, cardamom, and then make it more palatable, tastier. Maybe use a little bit of honey with that, and then make people have it. But like we said, that's one of the things that has been explained very clearly in a lot of places, that you have goat's milk, and then you start to wonder why goat's milk has been given everywhere in respiratory problems, and then you go back and you study and you research, and then you find out that goats have a natural immunity towards tuberculosis, which is one of the most deadliest disease anyone can have in the respiratory system. So that's probably the reason, and then you can obviously relate to why they have been saying this all throughout the text. Okay, we will have a quick short break and come back in 15 minutes. Okay, and then we'll continue. Okay.